The broadcast is now starting. All attendees are in.
Good afternoon, everybody. This is Joanna Walker, Head of Private Clients at CAF Philanthropy, and I am delighted to welcome you today to our third webinar in our CAF Philanthropy series on the mental health crisis in children and young people. For those of you who've not joined us at a webinar before, this is a series of broadcasts we've been doing over the summer and into the autumn to help raise awareness of particular issues that our donors and clients have told us they're interested in, and we'd just like to know more about and share expertise with some key leaders in the field. So thank you for joining us today. We're absolutely delighted to be here. A few sort of housekeeping rules around the structure of today's webinar. It is a discussion, not a lecture, you'll be thrilled to hear. And so we would like you to get involved, participate in the audience poll and questions throughout the webinar. Please do send us your questions. And if you have any questions, write them in the chat space and we'll cover them during the webinar. Or if you have questions you'd like to answer afterwards, please do email us at webinars@cafonline.org. I know some of you have sent questions in already, so thank you very much. We will be recording the webinar and email it to you a day or two after the event. Do complete the short survey at the end as well of the broadcast. So it'll take a minute or two to complete, but it really helps us to understand how things are going, whether this is the kind of thing you'd like, and to help us to make any improvements as we go along. So thank you for joining us. Okay, so to welcome our three guest speakers today, we have three leading lights in the world of children and young people's mental health, which I am absolutely thrilled to introduce to you. First of all, we have Kristen Schmidt, who is Portfolio Manager on the Children and Young People's Mental Health Programme at MQ, a research organisation which is transforming mental health through research. Kristen, welcome today. Thank you for joining us.
Hello, thank you very much for having us.
Thank you. Our second speaker today is Catherine Roach, Chief Executive of Place to Be. Catherine's background is in education and also consulting with KPMG before she became Chief Executive. And Place to Be delivers interventions in primary schools and schools throughout the UK, delivering on-the-ground support for children. So Catherine, welcome today. Thank you for joining us.
Good afternoon. Delighted to be here, Joanna.
Great, thank you. And finally, our third speaker of the day is Chris Martin, Chief Executive of The Mix. Chris has been at The Mix for 3 years, and The Mix has a multi-issue advice and crisis support service for young people under 25 that works exclusively through digital channels. I think Chris's take on the power of digital for good or ill will be an interesting theme for us today in the session. So welcome, Chris. Thank you for joining us. So just to kick off a little bit around the context of why we're talking about children and young people's mental health today, I think we are all seeing in the media all the time, and particularly over the summer holidays, there's an awful lot of talk about the health of young people and what they're doing and how they're spending their time, and a sense that young people and children in the UK today are really suffering quite a substantial mental health crisis. I think all of us have come across somebody or someone at some point in our lives who has experienced a mental health issue at a relatively or very young age. And it feels to me something that is really increasing, and we're seeing increasingly frequently, whether it's concerns around children spending all their time on gaming and computers and not getting out and exploring nature, or loneliness, or the pressure of social media and the interaction all the time. And these sort of things are something that we thought at CAF would be important for us to explore in more detail, to really understand what is happening with children and young people today. I personally am very interested in it as a trustee of Brook Young People, which is the sexual health charity that looks after young people's well-being in the round. And as a parent of two very young children, I'm sort of looking at these world ahead of them, thinking, how on earth am I supposed to navigate this as somebody who didn't grow up in this environment? So it'd be fascinating to hear today from our three speakers. So moving first of all to the first bit of audience interaction before our first speaker. So this is to test your reflex skills. We have a question for you in the audience. How long do children and young people with mental health problems go, on average, between first becoming unwell and then getting any help? Is it 18 months? They wait 18 months before they seek help? Do they wait 3 years? Or do they wait 10 years? Please tell us your thoughts now, which one you think. Select the answer you think it is, and then we'll have the results before we move on to our first speaker, Kristen. Okay, so the audience's perception is that most people, 57% of you, think that it's 3 years between when people first experience mental health issues. 4% of you think it's 18 months, and 39% of you think it is 10 years. So most people think it's 3 years between when things are first happen and then people take intervention. As I understand it, Kristen, the actual answer is 10 years. Is that correct?
Yes, so that's right. I think this is very much a statistic that we don't fully understand as well, that it's something, it could be due to people not immediately trying to seek help as well, or not knowing how to recognize particular issues. But it has been found that it's in fact 10 years, which of course is far too long.
That's an extraordinarily long time. So just on that bombshell, please perhaps you could talk to us a little bit more, Kristen, about, in general, the mental health issues that children and young people are facing today, and how you at MQ are tackling it from a research and strategic point of view.
Yeah, absolutely. So I think it's really hard to overstate the scope of the mental health crisis. I think in 2011, the overall cost to the world economy for mental illness was estimated to be about $2.5 trillion, and that's projected to increase. And depression is really a leading cause of disability worldwide. But there is good news too. There's awareness is rising, stigma is decreasing, and so there's a lot of hope that through joined up efforts we can do a lot of good work to improve the situation. MQ has been set up to take on a major challenge in this area, which is to make mental health research a public priority. And we're the first major charity raising funds to invest in research in the area of mental health. So research is needed really to help us tackle the major challenges in mental health, because it helps us to increase understanding. There's a lot of things we don't have answers to yet. And it can also help us improve treatments, because they can be hard to access. We don't know what works well for different people, for different illnesses. And it can help to bring some hope of prevention somewhere in the future, an area where there's really been too little focus for too long. So we were set up to fund world-class scientific research and to build public support for research generally. In young people specifically, there's really a perfect storm of changes and circumstances that young people face. So 75% of mental illness that continues into adulthood actually develops before the age of 18, and 50% before the age of 15. So these are huge numbers, and it goes to show that mental health problems in young people have an impact on lifelong well-being. And in a recent survey, a clear majority of parents worry that children and young people experiencing mental illness and mental health problems worry that it really would be a life sentence for their child. There's a majority of people not in contact with services, and as we discussed earlier, it does take an average of about a decade to get help after first experiencing some symptoms. So in absolute terms, that's 3 children in every classroom that do experience some form of mental health problems, and mental health conditions are the largest risk factor for suicide, which is not at all an isolated problem. It's the second leading cause of death for young men and women. And despite all of this, our understanding of mental illness and in children and young people is still sorely lacking, and so are the funds to change this. So MQ's research strategy has 3 components. So we work in the world of data science, and we also fund fellows, so junior researchers in mental health science who are at the verge of establishing independence to really become leading lights in that. And then the third part, which is very relevant today, is our children's and young people's program. So that's the Brighter Futures program. And with these research programs, we envision to create a world where mental illness is understood, effectively treated, and ultimately prevented. The Brighter Futures program is really MQ's approach to tackling the challenges that we discussed briefly, supporting research at a very critical time in development to target problems as they emerge and thereby affect lifelong changes. To change the path of mental illness, at that particular age, I think can be done through different ways. So one is that we need to understand how mental illness develops. Unless we understand normal development, we can't really understand how it deviates, but particularly at critical phases, we need to understand what makes someone be resilient to major life changes and major stresses and all the things that today's world throws at us, but at the same time, to really understand what can impair someone's ability to respond to that. And then to identify and treat those who are most at risk. So we have some ways of saying actually there's risk factors that change, that increase the potential that people develop problems. So what can we do with those? How can we identify those? How can we support those young people? And finally, to really develop effective interventions and ensure they're implemented. So effective interventions very early at this critical time point. And we do this through funding major research programs, major research projects. So we have a large grant to support the linkage of a lot of the amazing data that the UK has on young people. So that includes administrative data, NHS data. So the Adolescent Data Platform seeks to integrate all of that into one big resource for us to be able to understand how people, what their pathways are. And then we have two further projects around depression and suicide. And those are such key problems in that age group. So we support two international teams of researchers who are trying to, one of them is trying to develop a tool to identify depression in early adolescence so that those people can be helped. And the other one to understand what makes someone likely to be to have suicidal thoughts and to engage in suicidal behaviors. But we understand that really we need to mobilize a community to be able to do this. This is not something that any particular group can do by themselves. So with research at its core, MQ hopes to build a movement for change, to work with patients, the public, young people, and with other charities, policymakers, and wider organizations.
That's fantastic, thank you. And fascinating to hear what MQ is doing. Kristen, in terms of some of the things you were talking about, you mentioned the critical phases of children and young people's lives. Could you tell us a little bit more about what those critical phases are?
Well, particularly, I think I was referring to adolescence, for example. So in adolescence, we know that there are a lot of developmental changes in the brain and in the body. So people are exposed to a whole range of hormones in a way that children at earlier ages aren't necessarily. But also there's a lot of external pressures. There are a lot of school pressures, environmental changes, family changes, becoming independent, social and peer groups. So it's something that one of the leading adolescence experts has called it a perfect storm of circumstances that people have to navigate.
It sounds incredibly challenging. So between the ages of sort of 11 and early 20s, you are
That's right.
Going from being a child to being an adult and have to cope with everything that involves. And in terms of the age range of children and young people you're looking at, are you researching into early years and very young children as well, or are you focusing on adolescents?
So the Brighter Future program that I discussed in a little detail today is focused on adolescents in particular, but we do fund other research through the other programs, and there are certainly people within that also look at earlier ages.
And is it right in that within early years there are certain things where the brain physically is changing and fixing at a certain point, and there are things that you can do at that age that you can't do, it's too late to do by the time they're 8 or 9, is that right?
There are critical periods of development, and there are different periods over the lifespan. So I do think there are particular periods in childhood where certain experiences will have a much bigger impact than they would have if the same thing happened, say, 20 years later.
Fascinating, thank you. Really interesting to hear how you're approaching it, and we look forward to kind of getting involved in the discussion a bit later on. Thank you. So moving now to our second audience question. This is a question for you, so please, fingers on buzzers. Which of the following statements relating to children with conduct disorders are true? They are 2 times more likely to leave school with no qualifications. Children are 4 times more likely to be drug dependent. Or are they 6 times more likely to die before the age of 30? Or is it all of the above? Please select your answers now, and then we will tell you the results shortly. Slightly shocking statistics, even those in themselves, actually. And the results are nearly in. Thank you. So 90% of you said that all of the above, which is worryingly absolutely correct. So going now to our next speaker, Catherine Roach. Perhaps, Catherine, you can give us a little bit more about what that looks like on the ground and explain to us how Place to Be is working with children and young people at a practical level.
Absolutely, Joanna. So we know that schools are very much on the front line. And we also know, Kirsten has outlined some of the statistics. And for us this afternoon, school leaders are struggling. We know from our work with the National Association of Head Teachers that 93% of school leaders are unable to access specialist mental health support for pupils when they need it. They're on the front lines, that's where children are day in, day out. Class teachers can see and are perfectly positioned to be able to identify and spot problems or children who may be struggling earlier on. And if you're a class teacher, that statistic of 1 in 10 children having a mental health problem, what that means is 3 children in front of you in your classroom, day in, day out, have a problem that needs professional mental health support. And we also know that in areas of real disadvantage, where there may be more complex socioeconomic factors, that there are at least as many as a further 3 who are at risk of developing a severe mental health problem. And teachers are not trained to be able to deal with this. And whilst we can, and I think we need to provide a level of understanding and skill for teachers, also they must not be expected to become the mental health experts. They need to have that specialist backup alongside with them. So for a class teacher, they may be faced with, for example, a little girl, from our experience of working in schools, a little girl who is lashing out, who's angry, who won't sit still in class, and you're struggling to, cope and educate and do your maths lesson with the rest of the class. But behind that story, that little girl, maybe somebody who's taken into foster care, feels completely powerless. Or another was, a small 7-year-old boy who, it turns out, was hiding in a cupboard at night. He wasn't sleeping in his bed, he was hiding in a cupboard because of the noise, domestic violence, and what's going on. And the class teacher can spot that there's something wrong, but they're not trained to be able to then, or have the time to actually then be able to take that child and get the support that they need. So in terms of Place to Be and where we come in, we've been around for 24 years, and we work very much in partnership with schools, embedded, working inside the school, hand in hand with school leaders and school staff, delivering what we refer to as a whole school approach. And that really is about supporting the whole school community. On the one hand, that's about promoting positive mental health, because it's so crucial that we address this issue and remove the stigma. And then on the other hand, it is about working with class teachers and the school community and identifying and addressing those problems early on, or getting the specialist support in where that is needed. So for a child, we can offer one-to-one counselling, targeted support, safe and accessible within their everyday environment. And that's particularly valuable within the primary school environment. It's just so easy and accessible. For a whole school approach is also about working with school leaders and class teachers. And that could be, when you have a professional embedded in the school, that can be a chat by the photocopier, it could be a booked appointment, it could be the professional providing input at an inset or a training day. And then there's also a crucial part of this is work with parents, because we can't do this in isolation. And having access to and being able to provide that support for parents, whether it's that early engagement where there may be stigma or fear, and out at the school gate and being able to engage and build a relationship and involve parents. Or in some of our schools, we've also got then a more intensive support, which takes us through to one-to-one counselling for parents who may need that for themselves, or who indeed, as parents, may not have been able to access support themselves when they were younger. All of this is backed up by the specialist team at our core centre with safeguarding supervision, because that is so important in providing mental health support and having that clinical governance.
And could you tell us a little bit, Catherine, about the impact of the work that you're doing? I know sort of got some information on the slide there, which is interesting, I think.
Absolutely. So Pro Bono Economics conducted a study, because evidence and impact is so crucial, and they conducted a study which looked at the outcomes from the work and the value of that long term, and that shows that £1 invested results in a £6.20 return over the long term. So that return comes both in terms of increased economic earnings and potential of that child as they grow up, and the trajectory that they can be on, as well as less cost in the criminal justice system, within the mental health system. So it's a prevention as well as the increased earnings that individual can deliver. So we absolutely know that this works. And I think we touched on earlier the importance of early intervention and promoting positive mental health. And one of the key aspects within Place to Be to promote that positive mental health is providing a service that all children can access. So part of that, we run a drop-in service, and around a third, and this is consistent year on year across the hundreds of schools we work in, around 40,000 children, 1 in 3 children, book an appointment. So you can build in that reflex, that encouragement, that ability to ask for help, to reach out and get help. And they do that individually, or they'll do that in small groups, which again is incredibly powerful, because you get children finding solutions, guided and encouraged by the professional. But it's not just for problems such as, for example, the friendship group, or we get lots of girls who might have fallen out in the playground. That can spiral, because that can mean that somebody doesn't want to go to school because they're upset, they're angry, they're anxious, and that can have a real impact on their ability to engage in learning within the school environment. But we also know that around over 40% of the safeguarding issues that we identify within Place to Be, which we then work with the school to address, are identified through that drop-in service. So it's a mechanism to really be able to identify what might be more serious issues as well. And so finally, a Place to Be, well, we love stats, we love impact, and there's a crucial part here, which actually is about learning the practice. And as Kirsten said, what intervention works for which children, and the duration of the intervention, and should we work with the child directly, should we work with the teacher, should we work with the parent. But we know our work is effective, and that almost 70% we get feedback from teachers, from parents, and we know that 70% of children show an improvement in their home life. For children with the most severe issues, as many as 80% show positive change. And we're looking at how that is sustained long term and over time. So we know this works. Last year we worked with 5,500 children around the country, and whilst we can look at the statistics, I think it's just crucial to remember that there is a child and a story and somebody's life behind every one of those statistics. And it's crucial that we get in early and progress this.
Thank you. That's absolutely fascinating. And Catherine, as somebody who started their career in teaching and is now working at Place to Be, which works very closely with teachers, do you see a difference in children's mental health from when you were a teacher to now working in this space particularly?
Well, I think the world is is complex and it's different. When I was a teacher, which was back in Ireland, which is also a different kind of community, I think we've got different family structures. You know, there may not be as many consistent adults that a child, or safe people that a child can go and talk to. Clearly, we'll talk more about digital and social media and the pressures there. There's also pressure within the education system, pressure to succeed. I think as even, you know, things like we've refined in our commercial world and things like marketing, we grow, you know, there's a pressure on children, you know, the whole issue around needs and wants. What do you need and what do you want? And this feeling amongst peer groups that you have to have things, and a kind of striving for perfectionism and fitting in and all of those things. I think they're more intense now than they were.
And that's bound to have that effect, yeah. And in terms of the funding cuts that we see, and the kind of the government, the austerity, the impact of austerity on schools, and the kind of schools like my children's school, which is forever telling me that they're having a funding crisis and it's a real challenge for them. Do you see that that's had an impact on children's mental health in schools, or young people's mental health?
I think it's a huge challenge within schools, and the school leaders that we work with are under real pressure in terms of budgets, and particularly where there are smaller schools, it is really, really challenging. And I think the pressure then that also puts on class teachers and the staff within the school system. And that in turn then means that they may well be less prepared or less able to deal with, you know, the challenges of the children in front of them also. But the funding is a huge issue, and we know how overstretched or understretched the mental health system is, and the whole system needs further resources.
Thank you. Yes. Fascinating. Thank you so much, Catherine. Please remember to send in your questions in advance throughout. Use the chat function, and we'll happily answer them in the Q&A towards the end. So moving now to our third audience question. This is slightly a test on your attention span so far, as we may well have given you the answer already. What percentage of adult mental health problems, excluding dementia, are established or is established by the age 14 before the age of 15? Is it 10%, 50%, or 75%? Please select your answers now. And we'll be moving shortly on. And the email address, if you think of emailing us afterwards, is webinars@cafonline.org. Okay, so the percentage of adult mental health problems established by the age of 14 or less than 15, 67% of you said it's 75%. That's actually before the age of 18. The answer is 50% of problems are established at an extremely young age. So moving on now to our third speaker, Chris Martin, welcome from The Mix.
Hello.
And Chris is going to talk to us a little bit about The Mix and the way that they work. And because it's a purely digitally based service rather than in schools as a place to be, your perspective on how you deliver interventions and the impact of the digital world on young people, it would be fascinating to hear. So, Chris, over to you.
Sure. Well, I think the place to start is probably why is it really important that we look at young people's mental health? We all want young people to have the opportunities that we had, and we want them to go on and thrive and be our future prime ministers and scientists and businessmen and women. But we can be really terrible at assuming that because we survived adolescence, that what's so different about today, and despite the evidence of the young people we see around us. And for me, what really drives me is that we know that mental health causes a huge amount of suffering for young people and their families, but also there's a real risk that we rob young people of these great futures if we don't help them overcome some of the challenges that they're facing. When we look at the reason why young people face these mental health issues in adolescence, there's probably three things we need to consider. The first is the challenges that every young person faces as they go through their journey to adulthood. The second is the changes that we go through in adolescence. And the third is the new environmental conditions in which young people live their lives. And technology is one of those. I mean, between the ages of about 11 and 25, we know that young people face a huge amount of challenges, but in a very short space of time. So they're going to be dealing with exams, they're leaving home, they may be going to uni, they face their first job, first handling of money, you may have significant problems in the family, they have their first relationships, And all of these happen in a very compacted period of time. And when you struggle with them, it's very easy to start feeling isolated and as if you're a failure and as if you're the only person in the world that it's happening to. And it's really notable that all that wonderful support that you get in primary school, where teachers have a wonderful duty of care and a parental duty of care, that starts tailing off very quickly when you enter secondary school as these issues start rising. Secondly, the young people's brains, our brains start to change around puberty, and they don't really settle down to about 25. An example of this would be our reward system is very, very active, so we're likely to seek to experiment with alcohol or drugs or to even seek the sort of dopamine hit of a like on social media. We're very prone to that. Our peers become very, very important to us, and so relationships and the status of relationships is absolutely key. And this is what social media really speaks to. And on top of all this, we have to consider that young people are not growing up in the same environment that we did. As young adults, it's now harder to live independently, to find a secure job. And this knowledge begins building pressure early in life. And an obvious example of this would be university fees. So young people know they've got this big potential financial burden to take on. So the pressure to succeed in exams, which we already know is one of the biggest drivers of poor mental health in young people, is more and more intense. So all these factors combined just turn the screw on adolescent mental health. And within this, we can't ignore the role of technology, both as a driver of poor mental health, but possibly also as our only sort of scalable opportunity to combat it. And most importantly, a real opportunity to give young people some agency in the management of their own mental health. We have to think, certainly for the young people that I deal with, sort of 11 to 25s, where do they go after childline? What have they got for them that's then going to help them get through these significant challenges they're going to face? We know technology, particularly social media, can be associated with depression and stress. It can be disruptive to social engagement that's so important to supporting good mental health. And we know that screen time can actually reduce oxytocin in the brain, which is the chemical that sort of binds us together and helps reduce feelings of isolation. But young people default to digital. It's an integral part of how they deal with their worlds, and they have huge confidence in its ability to help them to learn, to communicate and create. In essence, digital is really good at accelerating things. So if you want to sell a lot of books very cheaply around the world, digital can help you do it really quickly. But it can also accelerate negative behaviors just as efficiently. So a young person who's being bullied, who previously might have sort of just had that going on in the playground, is suddenly being bullied 24 hours a day, and that can be a real killer. Or a young woman who's not feeling confident about how she looks can go on Instagram and start making false comparisons and sow the seeds of an eating disorder. So digital will accelerate negative things when they're going on in a young person's life. The mix is unique in that it works entirely through these digital channels, through social media, websites, and moderated peer communities. We also have a helpline and online counsellors. And we believe that digital is absolutely the best way to talk to young people. They can talk to us anonymously at the point at which they need help. We're here 24 hours a day. And in an environment where young people can wait up to 52 weeks for a CAMHS referral, that's pretty important. We feel we can be an antidote to some of the negative pressures that young people feel online by connecting young people to experts and supportive peers, by making information clear and understandable, and by working to build confidence to take control in their lives. Those are the three things we try to do. And in practical terms, we act as a big front door for those struggling with these kind of challenges that drive poor mental health, so we can often be the first step in an ongoing journey into specialist support, whether they be from other charities or they be from clinical services and so forth. About 60% of the young people that come to our service haven't accessed any other type of support before, and a lot of the work that we do is about helping young people understand what they're going through, how they can cope with things like anxiety and depression, or more serious things like self-harm. And really on the sharp end, our crisis text service, for example, calls an ambulance every day for a young person with active suicidal thoughts. It's interesting that the three most popular words used on that service are ashamed, scared and alone. So it just gives you some sense of the severity in which these issues are felt by young people. I'd like to end on a bit more of a positive. Digital services like ours offer us a real opportunity to make life-changing interventions with young people. Digital has two powerful weapons in its armory to support better mental health. One is data, to allow us to better understand the causes of some of these issues, and I'm really excited to be seeing the work that MQ does. And the second is the amazing ability to challenge stigma and to facilitate peer support at scale through other young people. The engine of the mix is the young people in our online community, most of whom have lived experience of mental health issues, and our volunteers, about 70% of them are under the age of 25. And despite being the most connected generation ever, helping young people make meaningful connections with a positive online community is really, really impactful. Young people have an app for everything, and we're really keen that our service be put in the pockets of every young person to help them manage their mental health more positively, especially when they feel they've got nowhere else to go and nowhere else to turn to.
Thank you, Chris. That's absolutely fascinating. And those three words are really incredibly powerful, I think. It's sort of ashamed, scared, and alone. I think the thing that for me that is so interesting about the world young people and children are living in and navigating right now is that always on, always connected. There is no real safe space. It used to be that if you were at school and you had a terrible time at school, you were being bullied, you would go home, shut your bedroom door, and you'd be perfectly fine until you went back to school the next morning. But now, because of smartphones and because of social media, you don't have that. It's hard to find that safe space where you're not connected to those issues 24/7.
It becomes very, very difficult for young people to unplug from the environment, which they're the digital environment, not least because it's driven by this tremendous desire to engage in peer activity and to know what everybody's doing 24 hours a day. I think the real thing is to help young people understand, actually to make sure that those connections are positive, and that young people also understand where the value in that lies and where the value does not lie. So there is a slight illusion that the connectivity that young people have by constantly talking to their friends through WhatsApp, for example, is as meaningful to them as physically meeting face to face and having those deeper discussions. So a lot of the work we do is often based around getting young people to understand that actually they do enjoy conversations with their parents, they do enjoy playing sports. We have very specific things which we do to reduce how much time they spend online, for example, by getting community members to go outside and take a picture of a tree and bring it back. So little things about how you reconnect young people with the real world, because that balance is probably the key part to supporting. But on the other hand, actually, this availability of the service when they need it, those dark times. I mean, we get contacted significantly out of hours of where normal services will be open. So most of our traffic is running between 8 o'clock and 3 a.m. in the morning, and that's you're not going to be able to go in and see a counsellor at that time. You're not going to be able to go and see a doctor unless you're in A&E. So, and actually that's when these issues which you've been struggling with and getting through during the day suddenly become overwhelming, and that's when we're there, and that's when those conversations start becoming really, really sort of life-saving.
Extraordinary. Thank you. So we are going to be moving now to a group discussion, and please send in your questions. We've got lots of questions so far, but we can never have too many. We have three very, very smart people who know lots about this area in the room, so take advantage and ask the questions while we're here. One of the things I wanted to put to all of the speakers here is if people could do one practical thing right now to support young people's mental health in their community or in their environment, their family, what it is, what would you recommend as sort of one practical thing they could do? Catherine, thoughts on that first?
Well, I think if you're a parent, take time with your children. Everybody leads such incredibly busy lives. We're always rushing around, but to actually take time out and actually really play, if it's with the little ones, sit down, play, listen, engage with them, so that they have that opportunity to open up, to share what's going on and really connect and share what's going on in their lives. So you build that and encourage them to talk about what they're feeling, as well as, you know, what they're thinking and doing.
Any other thoughts?
I mean, I think if you're a young person, it's although it's really difficult, it's about going out and making a connection. You're not on your own. You can feel like the world is really closing in around you and there's no way out of the situation which you're in. You've got to try and get out and talk to somebody. And actually a service like ours is pretty good. You can come and you don't have to say who you are, where you're from, and you can just begin talking about what you're going through and how you're feeling. And that's the first step to getting better. And it is a first step to getting better.
Mm-hmm. Kristen?
Yeah, I think I agree very much. And to add to that, I think there's a lot around understanding your mental health. We put a lot of effort into teaching children and young people around physical health and how to look after themselves. And we need to learn how to teach them about their mental health as well.
Mm-hmm. Thank you. And Catherine, you talked about promoting positive mental health. What does that look like? And how could other people sort of engage in that?
Well, I think one of the big things is about removing the stigma around mental health and promoting mental health as Kristen has just said, as of equal importance as physical health. So in the last year, ourselves and a number of other charities, including Chris at the Mix, were part of the Heads Together campaign, and that was all about encouraging people to have open conversations about their mental health. We all go through. Every one of us will go through challenging times, whether it's the common issues being grief, the big ones, grief, loss, and change. And I think leading by example, if we're the adults, showing that it's okay to talk to people, letting people know and being able to reach out and ask for help, or just share with others, and also listening to others, picking up how it's just taking time out, I think, in these very busy lives.
Sounds so easy to do, doesn't it? But we're all guilty of being too switched on. Chris, we were talking when we were kind of preparing for this sort of session about self-harm and the sort of increase in prevalence of self-harm. And actually, I was surprised that sort of my understanding of self-harm is very much around visible cutting or this kind of thing. But actually you were saying that for some young men, self-harm manifests in a very different way. Perhaps you could tell us a little more about that.
So what I think to understand about self-harm is fundamentally it's to do with coping. It's to try and find some way of controlling your world when you feel really out of control. I think lots of people do see it as these traditional young girls cutting themselves in their bedroom. Actually, self-harm is prevalent across just as many young men as it is young women. Young men tend to do slightly different things. So young men are prone to risky behaviours, to maybe getting into fights, to being angry, and so you end up seeing young men sort of being excluded from school and in trouble in the classroom, whereas in fact, it's a negative, damaging behaviour, which they're trying to take some control of their world. So they do slightly different things, and actually, it's an interesting factor in mental health research that there are men and women do have a slightly different pattern in what they do and how they're able to externalize or internalize the problems which they're going through and what that then manifests itself as. And self-harm is one of those things. And we could probably do with a little bit more research on the difference between the boy-girl sort of dynamic and actually how the same mental health issues both are facing are manifest.
Kristen, tell us a little bit more about men and women and the differences.
I mean, it's just a very, very good point, and I think a large amount of research has been done simply due to what's been available, the funds that have been available, and the populations that have been available in fairly contained groups of people. So there's a lot of the complexity around different groups, say men and women, but also lots of other factors where we simply don't know how mental health problems manifest. And we need to be able to move to a type of research that can account for a lot of those complexities if we want to be able to help people across the board.
And you mentioned earlier on that actually in some of the research you're doing, we don't know what the normal behaviour and reaction of young people is to certain situations. Is that right?
I think to a large extent, mental health science is still quite a new discipline. It's been divided up into neuroscience and psychology and sort of some of the social sciences and lots of different disciplines. And in recent years, we've luckily seen a drive to try and combine those to really understand how mental health overall develops. So we have a long way to go. It's going in the right direction, but yeah, we will need a lot more investment to be able to really understand the full picture.
Well, hopefully that will be sort of forthcoming in due course. And I think that the kind of the breaking of the barriers and the stigma that you've all talked about, and the more people do talk about this kind of thing, the more normalised it becomes. And actually, it is just a health issue, as any kind of physical health issue, and hopefully that will help to contribute. We're going to move on to the audience questions and answers. I've got a flurry of questions coming at me, which is great. Please keep them coming. We just have one question for the audience before we move back to our panel. So our final question for you so far. Whether or not you've donated to a mental health cause in the past, having heard from our speakers so far, would you now? Yes, no, or maybe I'm not sure. Please select your answers. And moving first to our first audience question. Catherine, this might be a good question for you. What training, if any, is available to teachers and schools to help spot and address the signs of mental health issues, concerns in young people?
Mental health and child development is not a core part of teacher training, of basic teacher training at this point in time. However, I think there are some moves to put in place, and with this year we have the implementation plans around the government's green paper looking at children's mental health and in schools. There are a number of initiatives identified within that which could introduce some training into some areas. But again, I think there's a question around the pace and the scale and the depth of that training. So I think it really is down to school leaders as to what they bring in themselves and what they can buy in and how they prioritise that. There are plans to make mental health awareness, to train up one person in every primary school with mental health awareness training, which is a one-day session. But I think this is a drop in the ocean by comparison with what that class teacher is facing day in, day out and could value. And we know that from our experience, that when you can provide more in-depth training over time, that is incredibly valued with real case examples and be able to talk class teachers through some of the challenging cases that they may be facing.
Mm-hmm. Wonderful, thank you. Yeah, I think there's certainly much more to be done. I'm absolutely amazed it's not part of a teacher training curriculum.
No, it's quite a packed curriculum, and I think that is the challenge. And particularly in England, it's very fragmented, and it's down to locally to different institutions as to what is in the core teacher training.
Mm-hmm. Thank you. So the results are in, and 86% of our audience would consider supporting mental health issues, which is wonderful news. So thank you so much to our speakers. Good work. Now moving to more of our questions that we've had coming in. This might be one for you, Chris. It's to do with digital. It is very clear that digital technology is harming the mental health of children and young people, yet at the same time, there's a lot of focus on finding solutions through digital tech. What are your thoughts on this? Is it just encouraging young people to utilise digital rather than seek alternatives?
Well, I think we live in a digital world, and actually we've got to look at what these tools can do for us. We're not going to go backwards in time. I mean, as I mentioned when I was talking previously, actually digital is going to allow us to generate a vast amount of data, which might really for the first time allow us to sort of see what it is actually the root causes of these in a way much more efficiently than they've been done before. I think digital has, if it's applied properly, has a great ability to add tremendous extra resource into existing services, to make them available much more frequently, to allow them to be run at lower cost and so forth. And I think also digital has an ability to go through us with our life and support positive behaviours as well. So I think we've got to look at how we drive it down those lines. What there has not been, I suspect, is, it's pretty new. I mean, WhatsApp, for example, has only been around since 2011. The iPhone, which has really driven this 24-hour culture, that's 2001. So we haven't really had these things around for long enough for us to sort of really know how they integrate properly into our lives in a responsible way. And we're starting now to see more pressure on the companies that build digital tools to actually consider what effect they're going to have on our mental health. Now, this is not just young people, this is adults as well. So I'm hoping that actually we can use some of the skills that sort of organisations like ours has developed to use these tools and hope that there'll be a bit more adoption of that as we build new stuff going forward, because it will continue. There's no stepping back. But we need to consider actually not just what's going to make this really saleable or really sticky or really addictive, but actually what this does to our society. And we legislate on lots of things. We legislate on how people can gamble. We legislate on how buildings can be designed. We just need to start thinking a little bit more, how are we going to make these things contributing to the human experience, not necessarily acting against it.
And the new operating system for Apple has a screen time function.
Yeah, it's got a health thing it's trying to allow their users to monitor the amount of time which they spend doing different activities within their phones. And I think that we'll see much more of this. So if you can get that awareness of going, look, you've been sitting here playing games for 4 hours and you've actually done your educational stuff for 20 minutes. Perhaps it's time to think about this. I think any adult will also be shocked at how they use those tools. I mean, my health thing, for example, yesterday I picked up my phone 135 times. I'm not sure.
Oh my goodness.
That's good.
Okay, thank you. We have a question here from our audience that's sort of related to personal experience, actually. Could you tell us what support services exist for parents of teenagers who are suffering? Above and beyond a GP just saying, here are some antidepressants. I think this is a very good question, actually.
Well, a place to be, we often encourage parents to access support via Young Minds, which is another of our charity partners. They can provide support.
Mm-hmm. Thank you. And we can send the link to that website as well to people after the webinar. Are universities doing enough to support young people with mental health issues, or are they just relying on charities to pick up the pieces?
I think universities, as other structures, are struggling to put in place the amount of support that's needed, and it's a changing environment, as with schools. So I do know there are initiatives to really try and drive that forward. But at the same time, in the UK in particular, I think that the charities are picking up a lot of the groundwork, and it's really good work, but they're not going to be able to do it without more centralised and institutional support.
Any other thoughts, Chris?
There's a very particular thing around universities. Firstly, there's a great bit of advice for universities from Universities UK, which sets out what good mental health might look like in universities. But it's a particular challenge and transition point for young people. So we find that actually you've got young people going into a highly stressful situation. They're away from their support systems at home. And they're dealing with all of these new people. It can be a really tough ride into university in the first instance. There's also a slight bit with a lot more young people going to university, so people have pre-existing mental health conditions arriving at university with them, which has also caused a drive. And as I mentioned with the fees, there's more pressure to be at uni, what it means there to be there. So I think that's a particular circumstance which needs looking at, and the suicide rates at universities actually have been it was stable this year, but have been rising year on year up until that point. So there's something we need to be looking at there and providing some of the support to the university institutions that they don't have at the moment.
Absolutely. We've had a couple of inquiries from people who are interested in setting up Place to Be in their schools as local councillors, so we'll refer them to you, Catherine, after their webinar, which is great.
Terrific.
Fantastic
Thank
news.
you.
And a question around organisations like the Scouts, the Girl Guides, who we kind of quoted earlier. How much do you feel they have a role in building resilience, confidence, key life skills, getting out and photographing trees and earning badges, as you sort of talked about earlier? And can they help combat some of the mental health challenges that young people face as part of the ecosystem, I suppose?
I think absolutely, definitely, and whether it's sports coaches, the Scouts, any of those wider environments that children and young people are in, where I think knowledge, understanding for the professionals, where they're facilitating those groups so that they also can identify spot issues and are able to provide a first line of support, and that they have the confidence to do that. I think one of the challenges is that the adults who may be around don't necessarily feel confident, and especially as we're talking more about mental health, people might be a bit worried as to what can I do, what can't I do. So I think everybody building a little bit more their understanding around mental health is part of what we need to do.
Yes.
I totally concur on that. Actually, it's really when we look at how young people in the sort of the adolescent age group seek support. Quite often, the first thing they do is they jump online, then they talk to their friends, and then they start reaching out actually to the people which they trust, have trusted relationships with them, and that's scoutmasters, sports mentors, youth workers, all of these guys, and they are quite often quite undertrained. And I think there's a real opportunity there to put services like ours to give them a little bit more of that support, just as they're trying to do with teachers, so they know how to handle those conversations and where to signpost young people off to.
Yeah, absolutely. I mean, these organizations really are a huge framework that can support that, and then they can also support the clinical services, because obviously mental health exists on a continuum, and people are not well or unwell and on a sort of dichotomous in that way. So to be able to signpost to clinical services when it's needed, these organizations need a lot of support and training.
Absolutely. And do you think there's a role for employers to help with young people's mental health? We talked a lot about schools, about universities, about young people themselves, about families and parents, but employers of young people, if we're covering people going up to the age of 25, is there a role for them to play? Anything they can do?
Me?
Go for it, Chris. Or anybody else.
If going into employment for the first time is another big transition point, and you know young people are going to be under pressure. So you're handling money for the first time, you're doing rent for the first time. Actually, it's quite a weird environment to go into, the world of work. So you've got to turn up at a certain time, and you're in a weird social position. I think there's lots of work to do around employers in general, around how they support the mental health of their employees. Actually, another one of our Heads Together partners, Mind, has just launched a fantastic new platform just last week, which brings together lots and lots of different resources for particularly SMEs. So SMEs are employing 90% of the UK population, and they are also the vast majority of charities as well. And we don't often have the resource or expertise to support our employee wellbeing effectively. So actually, that's worth a visit.
Yes, we can signpost in that Mind resource. Catherine, you have some thoughts?
I was just going to add also, in terms of schools and schools as employer, the Mentally Healthy Schools website, which is also part of the developments through Heads Together, is another really great resource with information, training, resources that teachers and schools can use.
Great, thank you. So we have too many questions to answer. I think I have time for just one more question to each of my audience here, and then we will ensure that they answer your questions before we leave so that we can send those out to you as part of the follow-up. So thank you so much for sending all your questions in. It's been absolutely fascinating. I would like each of our speakers now to sort of end on a note of hope. Is there a glimmer of hope they can see in young people and children's mental health, and what is that for the future? Perhaps, Catherine, to you first.
Well, I think things are changing. It's fantastic that we're beginning to shift the stigma. People are talking about mental health, and I think the government is beginning to sit up and pay attention to it and committing to some change. So that's a positive thing to build on.
Yes, yes, indeed. Chris?
I mean, what always inspires me is actually that the people who use our service are so keen to help other young people. So about 84% of them, once they've been helped by the Mix, they want to go on and do something else. They become active people promoting challenging stigma, reaching out to other young people. So I think there's a tremendous resource there of people who really want to not only look at how they help themselves, but also how they help others. And so I think that's something that we can really use to make a massive dent in this.
Thank you. And Kristen, in the world of research.
I think all these issues we talk about our current environment, about the accelerated environment, the fast-paced thing, it also means that we do have huge amounts of information. And if we use that in the right way, if we use all of that data, we actually have a fantastic ability to try and get to the heart of the problem and use the best available solutions. And actually, I'm very glad that the question about workplace mental health was asked, because we have a lot of people approaching us, and it's something that we need a lot more understanding of in terms of being able to support people leading a very full life and supporting employers as well.
Wonderful. So there is some hope, and the use of big data for good, I think, can only be a good thing in my book. So thank you finally to each of our speakers. It's been absolutely fascinating today to have you, and thank you for taking the time. Thank you for listening, and please do take a moment to answer our poll at the end. Goodbye.